It's a pleasure to be here today to describe to you our technology. I think it's important for the community to understand what's behind the result so that it can be used most impactfully on the floor of the hospital. So I thought I would talk about exactly how we provide rapid susceptibility information. Before we get into that detail and take a real technical deep dive, I thought I'd tell a little story about how this technology came to being. So it started with a relatively simple concept. The concept was essentially to look at individual bacterial cells and the response to antibiotic. The reason behind this general direction was the observation that Keith highlighted in the previous talk, that it just takes too long for susceptibility results to be provided to treating physicians in order to impact patient care in a meaningful way. So we started with a simple concept, thank goodness, and through a significant amount of engineering work, progressed from essentially an automated microscope on the left to a semi-automated setup in the middle, and then to the far right, our first fully integrated instrument that could accept a positive blood culture specimen and produce an identification and susceptibility result in less than 8 hours. So again, simple concept, a lot of work and blood, sweat, and tears behind bringing it to the market, and I thought we'd talk today a little bit about how this device works. In terms of the impact of the device can handle specimens like positive blood cultures. That's our first product focus. We will not stop there. We will work on skin and soft tissue, as well as respiratory specimens and other specimens, because certainly there are a lot of important specimens that hit the microbiological laboratory where the community is waiting for results. Compare and contrast what Keith just went through with respect to patient one, where culture essentially took an additional day after the bottle popped positive. And then, of course, standard ID and an AST followed. So the end result is about 48 hours later, receiving the identification and susceptibility profile for the organism in case one. In case two, the situation was a bit more complex. The patient had a polymicrobial infection, Staph aureus, and another organism, and it took quite a bit longer to tease this one out from the clinical microbiological perspective, and thus the delays in terms of reporting susceptibility were increased. And this is a theme that we hear from many lab directors in terms of the time that it takes and the frustration that they experience in terms of being unable to present susceptibility information in a timely manner. So, our system, again, it's solution-focused. We have many different technologies that we've brought to bear in combination in order to drive susceptibility test results in a timely manner. We have an onboard automated sample prep procedure that we'll talk about in a bit. We, of course, use, we report out identification. For positive blood cultures, identification is not reported, but for other specimens, we will report out the quantity of organisms present in specimens. And then, of course, susceptibility test analysis, where we look at organisms growing in the presence of antibiotic in real time. So we'll get into each of these areas in the remainder of the talk, but before I go into the detail behind the technology, I just want to point out that our setup is a little bit different than a standard microbiological kind of processing or culture method. Here is our Petri dish. On the left-hand side, our Petri dish analog. We have a cassette that's multiplexed. It has 48 channels that we can dedicate for ID and AST separately. We currently have 20 defined for identification and 28 available for susceptibility testing. The cassette, in combination with the cartridge, is loaded into an instrument. A button is pressed, and the process is completely automated from that point forward. I think of the reagent cartridge as essentially a miniature microbiological laboratory. It can do everything that's needed to do to report out an ID and AST result for a defined panel of organisms and antibiotics. In terms of how the automated specimen preparation process works, the specimens from positive blood cultures are diluted in a lysis buffer. That enables the gel, which is shown here, a gel well, to essentially filtrate out the debris and retain the bacterial cells. So as the electric field is applied, the debris migrate into the gel, the bacterial cells arrest on the gel wall that forms the gel well, and the electric field is reversed, bouncing the cells off of the gel well and then enabling us to recover them for further downstream steps. The next step in the process is to immobilize bacteria on a solid surface. This enables us to perform fluorescent in situ hybridization as well as downstream susceptibility testing. The process is very rapid. In fact, the specimen prep and the EKC process are both complete in very short order, under 15 minutes in total time. We then carry the fish channels forward to perform identification. We use universal bacterial control probes in conjunction with a target-specific probe to compare and contrast and help us identify when polymicrobial specimens are present. As mentioned earlier, we can quantitate the number of bacteria by simply counting and enumerating and tracking how much specimen volume was loaded into the device. Now for the fun stuff. In terms of susceptibility testing, when we started off, we had initially thought of the device as supporting primarily just susceptible, non-susceptible type reports. But as we dug deeper into looking at bacteria and drug combinations, we began to realize that there was a tremendous wealth of information that could be extracted from our time-lapse images by looking at each and every cell growing into its progeny and tracking that over time. So on the right-hand side of the slide here, you'll see that we have a plot of the logarithm of the intensity of each and every cell over time. And on the x-axis, we have time measured in hours. So you can see that the response is quite rapid, and this was very exciting during our initial studies. I'd also like to point out that we can, with our automated analysis, track each and every cell growing into a clone over time, and that enables us to track the population response to an antibiotic. So rather than average, if you will, what's happening to all bacteria, we can look at each and every bacteria individually and analyze it in that way. But more on that later. So we have an example of E. coli in the top plot, grown in the presence of 4 micrograms per mil of piperacillin tazobactam. This particular isolate has an MIC of 8, and as it filaments in the presence of antibiotic, it eventually lyses, indicating susceptibility. So we can correlate this response to susceptibility. Compare and contrast it to the bottom, where we have a resistant isolate growing as if there were no antibiotic present, and this is something that we see fairly commonly with highly resistant organisms grown in our system. So we have a range of responses that we can use to correlate then with MIC. Here's another example of a bug-drug combination where we're looking at E. coli and ceftazidime. In this case, we have an isolate having an MIC of 32 in comparison to an isolate having an MIC of 2. So there's a significant response difference, if you will, that we're able to leverage. And I think this next slide helps drive home the point about how we can report out an MIC using our technology. So here we have yet another bacterial and drug combination. We're looking at Pseudomonas aeruginosa and ciprofloxacin. All of these isolates, well, there are separate isolates in these 6 plots. The isolate in the upper left-hand corner was spiked into a positive blood culture, identified and run on our system, and it has an MIC of 8. As we walk from left to right, the MIC decreases for each of these separate isolates to as low as 0.25 micrograms per mil. Again, all of these isolates were challenged with 1 concentration of antibiotic. And you can see that from resistance to susceptibility, the dynamic or the response and interaction of the cells and their corresponding growth and actual lysis, as exhibited by some of these gray lines essentially dropping or falling off the plot in a waterfall pattern that we've tend to call it at our organization, correspond very nicely to the relative MIC of the organisms. And this is, in fact, how we generate MICs for our device. Because we have microscopy built into our system, we're able to leverage things like not only growth kinetics, but also cell morphology, and we can differentiate between different types of cells in our system. And that enables us to handle combinations of certain classes and groups of organisms. So we can use both the cell morphology, it's also the morphokinetics of the growth colony or microcolony that are also very indicative of specific species that we can use to separate out in silico and bypass isolation and report out MICs separately for mixed specimens. This next slide describes and drives home the point of how different things can look under the microscope. Not surprisingly, in a growth control, we see robust growth for both Klebsiella and Staph aureus mixed together. This is a crop portion of the field of view, and then this is a zoomed-in view of a single cell of Klebsiella growing into a microcolony or clone, and a single cell of Staph aureus or a small number of Staph aureus cells growing into a clone. So we can separate these out in a growth control as well as in the presence of antibiotic. So in the upper right-hand corner, we're looking at erythromycin and clindamycin challenge. Not surprisingly, very little effect for the gram-negative Klebsiella pneumoniae, but yet Staph aureus shows very little growth in the presence of this particular antibiotic challenge. So this is how we're able to report out results for Staph aureus and Klebsiella when both organisms are present in the same flow channel. On the bottom right, we have cefoxitin, and again, Klebsiella and Staph aureus. In this case, Klebsiella is exhibiting some susceptibility to cefoxitin, whereas the Staph aureus clones are growing robustly, which is not surprising considering the MRSA character of this particular Staph aureus isolate that we worked with. Our panel covers a significant number of gram-positive and antibiotics as well. The panel was I can tell you, a very difficult panel to arrive at, but we believe it's a good start in terms of providing content to clinical microbiological laboratories and attending physicians. Our panel for gram-negatives, again, a little bit broader in terms of its antibiotic coverage, considering the complexity that the community faces with gram-negative organisms in terms of resistance and its expression. So, having gone through a very rapid overview of the technology, I thought I'd bring us back to the patient in case 1 example that was described earlier. In our technology, what we would see is universal bacterial probes light up in all of the channels, except, of course, for the yeast flow cells, where we have a different controlled probe. The Pseudomonas aeruginosa channel, shown in orange, would be positive, indicating the presence of this organism in the sample. And here's an example of the universal stain compared to the target-specific probe. So in cases where the target and the control probe overlap one-to-one, we can be confident that there's a monomicrobial present. And so that's an important aspect of the technology. And then carry this forward with Pseudomonas specific drugs. Here we have meropenem and tobramycin on the top and bottom of this slide, and you can see the dramatic difference in response. So this is the sort of information that we're very eager to report out to infectious disease docs and treating physicians with our product because we think it'll be quite impactful. In terms of case 2, we have a mix, and here we have a mix of E. coli and Staph aureus. Again, universal bacterial probes light up, but target probes do not in the majority of the channels. And then, of course, the E. coli and Staph aureus specific probes are both positive, indicating the presence of 2 organisms in this particular sample. And again, we have another series of time-lapse images describing how E. coli responds to tobramycin, cefepime, and then Staph aureus versus vancomycin and cefoxitin. So the system is capable of reporting out very rapidly resistance to cefepime, susceptibility to tobramycin, resistance to cefoxitin, and susceptibility to vancomycin. To summarize, the device is a combination of a high-speed diagnostic tool that enables a simple workflow consolidated such that it's easy to use, and we believe provides superior information. So the future, I'd like to spend a little bit of time talking about. All of the slides previously have just talked about correlating with MIC, and that's just the beginning, because we believe we can pull out of these particular growth profiles a tremendous amount of information, which we need the help from the community to understand exactly and interpret what this information may mean. So in the upper left-hand corner, we have a plot of the clone intensity over time and the corresponding instantaneous division rate of each of the clones. So this is a population profile of its response with time. And then, of course, a time effect curve that we can generate. And finally, we always have images to go back to, if needed, to help us untangle complex microbiology. So that's the overview. And at this point, I'll turn it over to Jim Lewis to give us a talk about how we might use this information.